Germ theory itself was kind of fought out and really won precedence. Like everybody got to kind of be on board with it through the realm of childbirth. Particularly in America, the doctors market was oversaturated. And so doctors needed a new market, basically. And they invented obstetrics. It was the first medical specialty ever in existence. And it took off in America like nowhere else in the world because doctors needed a new market to populate because there were too many of them to all be general practitioners. And to do this, they also had to kind of push midwives out. And so they kind of embarked on this sort of whisper campaign, if you will, of convincing the public that birth was inherently risky, inherently pathological, and that midwives were kind of backwards and old school and couldn't really help you with those things. Vice versa, what they had to do was say, but we can help you because we have tools and medicines. Pause for a second as this is happening and the obstetricians are coming more and more into the birthing field. So I would say by like 1860, no middle or upper class woman would have had a midwife. It was unfashionable and sort of low class. What some doctors are noticing at this point is that female mortality postpartum is skyrocketing. And Ignaz Semmelweis, his name is still memorized by like every med student ever, was tracking data in hospitals. Now, most women still weren't giving birth in hospitals. Only poor women were, ironically, because they were kind of hotbeds of infection in a time when you didn't have like antibiotics or hand washing. What Semmelweis noticed is that on the wards presided over by doctors, there was a lot more postpartum death than the ones presided over by midwives. He theorized that maybe it was something they were touching and spreading via germs in autopsies.
I've heard this.
Yes. And so he then was like, okay, you people, half of you wash your hands, half of you don't. And he noticed that, you know, the death rate went down. Well, what is a little bit less talked about of this story, that's kind of the famous narrative, is that doctors were really aggressively angry about this. Both, I think, because like this was their livelihood and they didn't know what to do about it if they were killing women, but also because of the gender norms. They really didn't want to think that their sort of realm of authority could be causing death. And so they got so aggressive about saying, no, our tools are working. So in a related narrative, now this isn't about germ theory specifically, they had ergot, which is a kind of related to LSD. You sometimes hear about it as posited for being what caused the Salem witch crisis, like maybe people had LSD poisoning. They could give you ergot, which would make the uterus pump to try to push out the baby, but you can't make it stop and you don't have good control over how hard the uterus pumps. And it would like, the uterus would often explode in the woman's body.
Yeah. So that was the squirming part.
Oh yeah, that's maybe my most squirmy one.
Okay.
Like it would just, oh, can you imagine what that would feel like? No, you can't. I've had two kids. I can.
I can't.
Really uncomfortable.